Cervical cancer is the second most common cancer in women in India at present, following breast. What is cervix? It is nothing but the mouth of the uterus or the womb from where a woman gives birth. The incidence of cervical cancer is actually coming down, but not to the extent which we expect. Why? Because this is a preventable cancer. Why I say it is a preventable cancer? Because it's caused 99% of cervical cancer is caused by a sexually transmitted virus called HPV, and if we control this infection earlier, we can prevent cervical cancer from developing in the long run. What this virus does is it will go into the cervix and causes some precancerous conditions, and which if we leave it untreated for years together, then only in some patients they develop cervical cancer. So if we catch this infection early and treat these precancerous conditions, we can totally prevent cervical cancer from developing. That is why WHO says this as a sexually transmitted preventable cancer. So what we need to do about it? All women who are sexually active or starting from the age of 25 years, you should do your regular pap smears. What is pap smear? Means you have to go to your gynecologist. She, with the help of a small brush, she will take a little bit sample or liquid from the cervix, which takes about 30 seconds for a gynecologist to do, and you have to do this only once in 3 years. If you do this, we can detect any changes if at all caused by HPV, and if it is there, if we treat it, you will definitely not develop cervical cancer in the long run. And how often we need to do this is, you have to do it every 3 years once. And if at all there is one more special test called HPV DNA, we do a combined co-test of those things. You can screen yourself only once in 5 years, and you have to do this till at least 65 years of age. The second very best mode of prevention is vaccination, that is HPV vaccination. The WHO has approved this vaccination, and India also has approved this vaccination for all females aged from 9 to 45 years of age. And only 3 doses needs to be taken, that is 0 dose, 1 month or 2 month dose, and a 6-month booster dose. And WHO has also told if you give it as early in 9 to 15 years of age, only 2 doses is sufficient. This vaccination is more effective if you give before a patient becomes or a person becomes sexually active. It is better to give between 9 to 15 years of age, but nevertheless, some benefit is always beneficial. So till 45 years, every woman can take this vaccination and get the benefit from it. Vaccination doesn't give you 100% protection, but it will definitely help in decreasing cervical cancer incidence.